Okay, here we are now changing gears into nursing diagnosis, and you will find this chapter. It is 17 in your Potter and Perry book. One of the things you need to know about nursing diagnosis is that we need to be careful and not to confuse it with a medical diagnosis. Uh, we have a medical diagnosis, nursing diagnosis, and collaborative problem. A medical diagnosis identifies a disease or condition based on specific evaluations or signs and symptoms, which in the nursing diagnosis, we're looking at a clinical judgment about an individual, family, a community response to an actual or potential health problem or life processes that the nurse is licensed and competent to treat. The one thing that makes the nursing diagnosis is unique is that we can involve patients whenever possible within this process, and that differs from medical diagnosis. So because it does give us our interventions, it is important that we select the proper nursing diagnosis for our patient's medical condition. And we also call these NANDAs. NANDAs, the acronym came from North American Nursing Diagnosis Association. It is what we call the nursing language. The nursing diagnostic process comes in different steps. Number one is we're going to do an assessment of our patient's health status. That's going to be based on patient, family, and healthcare resources that we're going to constitute a database. Once we constitute this database, we're going to clarify anything that can possibly be inconsistent, that's unclear, any information we need to do more follow-up on. As we go through this process, we do need critical thinking because that's what's going to guide us into the proper questions to ask and the proper exam to do on our patient. And it's also going to reveal detailed and relevant databases that we need to include to validate this nursing diagnosis, which is our next step. Validate the data. You need to have enough validation of your data, whether that be you're looking at labs, any kind of diagnostic test. You're going to bring all this together. Once you have all this data, you're going to ask yourself, do I need more information to validate this nursing diagnosis? If so, you need to reassess and continue. The process itself, now let's say you got to the point where you do not need any more data. So now you're going to start interpreting, analyzing, and finding meaning to this data that you got. You're just not going to grab data and forget about it. You need to validate it. You're going to start clustering information. You're going to group signs and symptoms. You're going to clarify and organize the information based on relevance and based on similarities. You're going to look at different defining characteristics, any factors that are related to. You're going to identify the needs of the patient. What does my patient need? And that's we at a later PowerPoint we're going to talk about our interventions, but you're looking at the patient as an individual patient, not necessarily at their medical diagnosis. As we know, our patients are very unique. They come with different kind of problems, so we need to develop this nursing diagnosis based on what's currently going on with them. So we're going to formulate these nursing diagnoses and collaborative problems. The diagnostic statements provides you a precise definition of what's going on with our patient's problems. It gives the nurse and other healthcare team members a common language for everybody to understand what are the needs of this patient. It allows nurses to communicate what they do among themselves, with other healthcare professionals, and the public. It distinguishes our nursing role from that of the physician or other healthcare providers. Helps nurses focus on the scope of the nursing practice. It fosters the development of the nursing knowledge along with creation of practice guidelines that is reflecting on the essence of nursing. Critical thinking and the nursing diagnostic process. The diagnostic process flows from assessment process and includes decision-making steps. You're going to do data clustering. You're going to identify health problems and formulate the diagnosis, or collaborative problems. As mentioned earlier, you do need critical thinking abilities in order to identify the proper nursing diagnosis that is going to be individual to your patient. In the practice of nursing, it is important that you know different nursing diagnoses, their definitions. What does it mean? What are the defining characteristics? Why choose this one in relation to the other? You have to have related to factors that are pertinent to the diagnosis and interventions that are suitable for the disease process that's going with your patient. Sources of information about nursing diagnosis include faculty, advanced practice nurses, documentation systems, practice guidelines, and protocols. In the application of critical thinking, standards help you thoroughly and comprehensively and accurately identify the nursing diagnosis that can apply to your patients. Data clustering. With data clustering, it is a set of signs or symptoms that you gather during your assessment. You're going to group these together in a way that makes sense. You're going to cluster patterns of data that have defining characteristics, clinical criteria that is observable and at the same time verifiable. Each clinical criteria can be an objective or subjective sign, symptom, or risk factor that when you analyze it with other criteria leads to the diagnostic conclusion. So examples of NANDA you can find in your book in page 227. There's box 17.3. Now, interpreting and identifying health problems. It is critical to select the correct diagnostic label for the need of your patient. From assessment to diagnosis, move from general information to specific. Think about the problem identified phase in assessment as in a general healthcare problem and formulate the nursing diagnosis specific to your patient's problem. When analyzing clusters of data, you want to begin to consider the patient's health problems. Your interpretation of the information will allow you to look at different areas of diagnoses, but you're going to apply one to your patient that is consistent with what's going on with your patient. Patients' defining characteristics will sometimes lead you to more than one, but you want to get one that is more specific to what's going on with your patient. So it's important to know the different similarity diagnoses to direct you to gather the proper information that you're going to use to clarify the interpretation. Examine carefully when you're selecting your characteristics in your database. You want to be able to support it, and at the same time you want to eliminate nursing diagnosis that can sound consistent with your patient, but you have one that's more accurate. You want to be as accurate as possible. You want to confirm your relevant ones. When you formulate a nursing diagnosis, you're going to look at a related to factor, which is a condition or historical factor or causative event that gives context for the defining characteristics and shows a type of relationship with the nursing diagnosis. So you want to individualize the nursing diagnosis further. You want to identify the associated factor. You're going to place a diagnosis into context of the patient's situation. You're going to clarify the nature of the patient's healthcare problems. As you're focusing on all of these different patterns, you want to define any characteristics. Compare your patient's pattern of data with other data that is consistent with normal health patterns. Use acceptable norms for comparison and judgment. You want to use labs, diagnostic tests, different professional standards, physiological limits. You want to make sure that you are focusing on your patient's actual and potential response to a healthcare problem rather than on physiological event, complication, or disease. A nurse cannot independently treat a medical diagnosis. For example, let's say your patient came in with a DVT. As a nurse on our own, we cannot treat this problem without the doctor putting in the necessary orders that we need to carry out some of these functions. As later we're going to learn, there's some interventions that are nurse associated interventions, and then you have doctor interventions, which would be those that we're going to add. For example, this patient with the DVT, we're going to be treating this patient with blood thinners. So we cannot independently put this patient on heparin, but the doctor can, so we can put that as part of our interventions that are going to be based around initially our nursing diagnosis. That is going to be one of the steps in the process. Types of nursing. So we have actual nursing diagnoses, we have risk for, and we have health promotion. As you develop the care plan you're going to develop for this class, you have been instructed to always start with the actual nursing diagnosis. With this, you're going to describe any human responses to health conditions or life processes. So with that one, it is what is currently going on with my patient. You're going to look at assessment data that is sufficient enough to establish this nursing diagnosis based on current problems. Risk factors serve as clues to indicate that a risk nursing diagnosis applies to the patient's condition. Now, a risk for nursing diagnosis that will describe a response to a health condition or life processes that will develop in a vulnerable individual, family, community. These diagnoses do not have defining characteristics because they have not occurred yet. It is something that the patient is at risk for. Now, going back to our patient that came in with a DVT, what are they at risk for now? We're obviously going to start a blood thinner on them, so now they're at risk for bleeding. Because they do have this blood clot for, say, let's say it's in the leg, this patient cannot ambulate. So now they're also at risk for impaired skin integrity because they're not going to be moving around as usual. Another problem they could be at risk for, now they could be at risk for atelectasis because they're not going to be up, walking, breathing, and expanding the lungs as they should. So this is how we look at risk for nursing diagnosis. When you're looking at health promotion nursing diagnosis, that one is a clinical judgment when you're looking at families or communities. So it's like a readiness to enhance well-being of actual human health potential as expressed in the readiness to focus on specific health behaviors. Some of the ones you'd look at for this would be any kind of nutrition, exercise, any kind of health promotion we're trying to give our community or families. Components of a nursing diagnosis, we have the NANDA here, and we have some of the definition on how we can write this out. So a common method of developing a nursing diagnosis is to assign a diagnostic label and then note the related or causative factor. I'm going to give you an example because your nursing diagnosis is a three-part. You can include diagnosis, etiological statements, and symptoms such as you're first going to have your nursing diagnoses. You're going to have a related to as evidenced by, and I'll give you an example a little later. You're going to have related to factors. It can be treatment related. This is where you can include pathophysiological, biological, or psychological. You can include maturation or situation, environment, or personal. And then they give you the PES format, which is kind of like what I gave you. Problem, you're going to look at the problem, etiology, and different kind of symptoms. As you are formulating these nursing diagnoses, you are going to also look at cultural relevance of the nursing diagnosis. It is important to consider the patient's own cultural competence as well as for you to be sensitive to their cultural practices in order to provide good health evaluations looking at the problems and different types of implications. You're going to, for example, ask them, what can I do, or what do you expect from me as your nurse to help maintain some of your cultural practices? Maybe this person only wants female nurses because they're Muslim and only a female can see them. So in order for us to make sure they're receiving comfortable, competent cultural care, we are going to acknowledge their request of only having female nurses. Another cultural practice can be certain diets, and we'd have to get that okayed from their physician. Let's say we have a patient that is not eating during their hospital stay because they're not familiar or they dislike the diets that we are currently giving them. it is completely okay to talk to a physician and see if maybe they can eat foods from home as long as it's not contraindicated to their diet. When making a diagnosis, be sure to consider how these cultural influences can relate can be related to the factor to your diagnostic statement. Make sure you're not using your own culture to influence any kind of characteristics to this patient's assessment. Okay, with this slide here, we're discussing concept mapping and how it relates to nursing diagnosis. With the concept mapping, what we're looking at is a visual representation of the patient, somewhat forming like a map. It places central focus on the patient rather than what's going on with the patient or any type of health alterations. It's helpful with nursing students to concentrate on specific health problems while they're formulating their nursing diagnoses. And the focus also promotes patient participation with the eventual plan of care. So it's always a good concept to use, which the whole thing is called concept map, because it's able to help you critically think and identifying things and putting them together in a certain cluster, things that match, things that make sense. For example, let's say you're developing a nursing diagnosis that has to do with a respiratory problem. So you can start placing things such as a chest x-ray. When you auscultate it, of course, because you have to do an assessment, so when you auscultated the breath sounds and you heard coarse breath sounds, vital signs such as oxygen saturation, other lab tests such as an ABG. So see how everything falls into play, and it's all dependent on this specific problem. It kind of paints a picture, and you're able to organize all these key concepts together, and then you get to analyze the information. And as we talked about earlier, patients have more than one health problem. They're usually not one problem and that's it. So it's able to kind of put things in order based on different types of problems. That's pretty much what I want you to know as far as concept mapping goes. You will later down the line, I believe, for some of your clinical courses, you will be doing concept maps, and you'll also have to do a care plan as well. And here are some of the sources of diagnostic error. Things can go wrong during the data collection, clustering, interpreting, and analysis of data, labeling the diagnosis, the diagnostic statement, documentation, and informatics. So you can have an error occur in any one of these times. So always you should try to avoid inaccurate or missing data and to collect data in an organized way. It's important to make sure that you can validate your information, and everything needs to be able to be measurable. If it's not measurable, then how are you going to evaluate? Objective physical findings are good because they're supportive, and remember that would be relevant to your nursing diagnosis. And also don't forget about subjective data as well. Errors in the data collection occur when data are clustered prematurely, incorrectly, or not at all. Begin interpreting by identifying and organizing some of your assessment patterns to support the presence of your patient's problems. Be careful not to include conflicting clues. Make sure what you have is, instead of making assumptions, make sure you have enough information to make your NANDA supported with data that you have collected that is important to your patient's problem, and making sure that things are documented accurately as well. Here is another quick quiz. Concept mapping is, and hopefully you have picked E. That is the answer. Diagnostic statement guidelines. Here are some guidelines to follow. So be sure that the etiology portion of the diagnostic statement is within the scope of nursing to diagnose and treat. Because medical diagnoses require medical interventions, it is legally inadvisable to include it in nursing diagnosis. So identify nursing diagnosis from a cluster of defining characteristics, not just from one single symptom. That's kind of like when you're clustering your information. And accurate etiology allows you to select nursing interventions directed toward correcting the cause of the problem or minimizing risk. There will be times when you formulate a certain NANDA, and one of your interventions can actually be because we have to be realistic. If we're dealing with a problem, that may take some time. And our problem, we have to have short goals in nursing school when we formulate these care plans. And when you do one for this class, you're also going to have to pick a short-term NANDA with your goal has to be short-term. And we're going to talk about that next. So what you want to do is make sure that it's realistic. And if at times you may have to put that you're going to make sure that your role will prevent the problem from getting worse. That's okay as well. You kind of like preventative measures that you will be doing. So identify an ANDA, diagnostic statement rather than the symptom, identify a treatable cause other than a risk factor rather than a clinical sign, chronic problem that is not treatable through nursing intervention. Kind of like we can't cure Parkinson's, so we can't cure dementia. So you kind of want to stay away from things like that. Now, a patient with dementia or Alzheimer's, maybe you want to prevent them from falling. That's completely okay. So identify the problem caused by the treatment or diagnostic study rather than the treatment or the study itself. And identify the patient's response to the equipment rather than the equipment itself. Hope it makes sense. If not, there's more stuff in your book that you can read where it can clear it up for you. So a continuation of the previous slide, nursing diagnoses are always patient-centered and form from the basis for a goal-directed care because we want to take care of things while we're caring for our patient within a day. You plan nursing interventions after identifying a nursing diagnosis. You want to have goals that are accurate identification of what's going on with your patient, and you want to base nursing diagnosis on subjective and objective patient data. Make sure you're not including any personal values or beliefs. Statements that imply blame, negligence, malpractice, things like that are not good to put in a care plan, or things that can incriminate you. Don't do that. Make sure that your statements are vague. Make sure that you do not put in statements that are vague and that give no direction to nursing care. It is okay to include multiple causes that may be contributing to one patient problem. Let's say you want to formulate a few nursing diagnoses that all have to do with one certain problem. You want to, you can put many different diagnoses to one problem. So you want to identify the patient problem rather than the goal of the care, make professional rather than prejudgmental judgments, avoid legally inadvisable statements, identify the problem and the cause to avoid a circular statement. Is one of those things I told you earlier. Here is another quick quiz question. So for a student to avoid a data collection error, the student should assess the patient, and if unsure of the finding, ask a faculty member to assess the patient. Review his or her own comfort level and competency with assessment skill. Ask another student to perform the assessment. Consider whether the diagnosis should be actual, potential, or risk. You should have selected A to this question. Nursing diagnosis, application of care planning. By learning to make accurate nursing diagnosis, you will plan your care and communicate to other professionals in an accurate manner. A nursing diagnosis will ensure that you select relevant and appropriate nursing interventions. Nursing diagnosis is a mechanism for identifying the domain of nursing. Diagnosis direct the planning process and the selection of nursing interventions to achieve desired outcomes for our patients, because that's essentially what we want. Also remember that with NANDAs, We also have nursing interventions and nursing outcomes, and we're actually going to talk about that in chapter 18. And just to introduce you to this, if you're not aware of it, we have what we call NIC and NOC interventions. NIC is nursing interventions, so NIC stands for Nursing Intervention Classification, and NOC is Nursing Outcome Classification. These facilitate the process of matching your nursing diagnoses with accurate and appropriate interventions and outcomes. So basically, there are books out there, and I'll bring one in so you can see books and how they can help you formulate these nursing care plans. When you make an accurate nursing diagnosis, everything else will be correct with your patient along with the interventions, and you'll be able to evaluate, and you will see that your patient has actually improved during your care. And that completes the lecture for Chapter 17, Nursing Diagnosis.